Hi, my name is Sylvia Azania, and we're going to talk in detail about semen washing for assisted reproduction in patients with HIV. We'll talk a little bit about what HIV is, how it's transmitted, and how assisted reproduction techniques can help in this situation. We will explain in detail what the semen washing process involves and how it is carried out. We will also discuss the different assisted reproduction techniques that can be used after semen washing, and we will answer the most frequently asked questions that users may have related to this topic. The human immunodeficiency virus, which is more commonly referred to as HIV, is a retrovirus that is transmitted through blood, sexual fluids, and vertical transmission from mother to child. It is very important to clearly distinguish between HIV and acquired immunodeficiency syndrome, or AIDS, which is the most serious stage of the condition that can affect those infected with HIV, given that their immune system is greatly impaired. The fact that HIV is sexually transmitted means that it may be advisable to resort to assisted reproduction techniques in order to achieve pregnancy. In this way, the risk of transmission of the virus from one partner to the other can be reduced in the case of being serodiscordant. It should be noted that a serodiscordant couple consists of one partner who carries the virus while the other does not. Nonetheless, if both members of the couple are seropositive, reinfection with different strains could be detrimental since it might exacerbate the condition of the illness. Therefore, these couples could also opt for assisted reproduction if they wish to have children. In the case that the man is HIV positive, a semen wash will be performed to prevent transmission to the woman during attempts to achieve pregnancy. Despite being controversial, it is generally believed that sperm cells themselves do not transmit the retrovirus. Therefore, semen washing involves carefully processing the semen sample with the specific goal of separating only the motile sperm. In this way, the possibility of the woman becoming infected with the virus during reproductive treatment is practically null. In order to carry out the semen washing procedure, the man must provide a semen sample to the andrology laboratory staff. Subsequently, using various techniques, the spermatozoa with the best motility are separated from the remaining components found in the semen, such as seminal plasma, lymphocytes, epithelial cells, immotile spermatozoa, etc. The most common and widely used method for separating the best sperm from the rest of the semen sample is to apply a double washing process. Therefore, a density gradient is performed followed by a swim-up. In order to perform the density gradient, various layers with different concentrations are placed in a tube. As a result of this process, a density gradient is established to separate the various semen fractions. The seminal sample is then added to the top of the tube, but after centrifugation, the mobile sperm will remain at the bottom of the tube. To perform the swim-up, the sperm recovered in the previous step are added to another tube containing culture medium. Following this, the tube must be incubated under specific controlled conditions. Subsequently, after the designated incubation period has passed, the spermatozoa with the best motility will have swum to the top of the tube from where they will be recovered by specialists. However, before the recovered sperm can be used in any type of reproductive treatment, it is necessary to confirm the complete absence of viruses in the sample. For this reason, half of the processed sample is analyzed, usually by PCR, in order to accurately confirm the absence of virus. The other half is carefully frozen while awaiting results. If the test result is negative, indicating that no virus is present, half of the sample that has been kept frozen is considered suitable for use in assisted reproduction treatment. If viruses are detected, the frozen sample is discarded to prevent any risk of transmission. In this last case, it would be necessary to begin the entire semen washing procedure, starting again with a new semen sample. Nevertheless, these samples are often free of viruses a high percentage of the time. Moreover, it can confidently be stated that the success rate of this procedure is very high, as no cases of HIV transmission have been reported after semen washing so far. Once the sample has been thoroughly tested and confirmed to be completely free of viral particles, it can be used in assisted reproduction. Initially, the sample may be utilized for either artificial insemination or in vitro fertilization procedures. However, some specialists choose to avoid performing artificial inseminations because of the concern about the higher theoretical risk of infection associated. Additionally, it is essential that the initial semen quality of the male is very good, so that once processed and subsequently thawed, the sample still contains a sufficient concentration of motile spermatozoa to achieve pregnancy with this technique. For all these reasons, the technique of choice after semen washing is usually IVF using ICSI, intracytoplasmic sperm injection. On the other hand, if the couple is experiencing fertility problems that make it difficult to achieve pregnancy through artificial insemination, IVF ICSI is chosen. And now we are going to answer some of the most frequently asked questions that users may have related to this topic. Is semen washing procedure effective for patients with HIV? Yes. Since one of the potential routes for the virus's transmission is through sexual contact, washing semen could significantly lower the risk of passing it on to a partner. The reason for this is that the motile sperm are isolated from the other components of the semen, including seminal plasma and various cells that could harbor the virus. Additionally, the absence of the virus is checked in a part of the sample obtained after this processing. In this way, only in the case of a negative result, indicating that there is no virus present in the sample, the other part of the sample may be used in an assisted reproduction treatment that will generally be ICSI. This way, the possibility of contagion is minimized. Is seminal washing only performed on patients with HIV infection? No. Semen washing can be performed in serodiscordant couples where the man is HIV positive, but it can also be effectively performed for hepatitis B and C viruses. In any case, the primary aim of seminal washing is to significantly reduce and minimize the risk of transmitting the infection to the partner during the pursuit of pregnancy. If you have any questions or concerns, please don't hesitate to leave us a comment below. If you enjoyed the video, please give it a like and subscribe so you don't miss any of the future videos. Additionally, I will include a link in the description to an article where you can read much more information related to this topic.